After months of government signals to reduce reliance on overseas care workers, it's no longer news that the rules have now changed and care providers in the UK can no longer recruit carers from overseas. Rather, they're expected to continue to hire British nationals or those that are already in the UK under certain conditions. Fair enough. But a new report just dropped and is telling a completely different story. Not only are the British workers leaving the care sector in huge numbers, but the only reason things haven't completely collapsed, according to this report, is because of overseas staff. Hello and welcome to my channel. My name is Evelyn if you're seeing me for the very first time. On this channel, I share updates about immigration policies. I also talk about working in the UK, living in the UK, and everything in between that. So if this kind of content interests you, kindly hit the subscribe button and turn on the notification bell so you don't miss any update from this channel. Now, going back to this article, the skills for care report as covered by the community care gave us a rare peek behind the curtains that the care sector grew because thousands of migrant workers stepped in and that British staff are leaving the care sector. In fact, there are fewer Brits working in the care sector now as they were 4 years ago. And will you blame anyone for leaving the care sector? We do know that the care sector is one of the lowest paid in the country as compared to other sectors, but the workload is huge. So it's somehow expected that people will only want what is better because you have bills to pay, you have a lot of things to take care of that needs money. So fair enough. However, let's move away from the numbers for a moment and focus on real people. These people are the ones that hold hands with someone in their final moments. They are the people that are lifting patients. And sometimes they are the only friendly faces that people would see all week. And most of them are immigrants. And one person shared a powerful comment in this article that I would like to share with you. She said, companies need to do a lot more to keep staff safe at work, particularly in work with learning disabilities. The rate of violence is horrendous, as are the injuries sustained. If you complain, your life is made hell. I have had broken ribs, a broken nose, been knocked unconscious, and badly bruised, all for minimum wage. The public do not realize the amount of training we do and the pressures that we are under. If it wasn't for foreign staff, the company wouldn't be able to exist. Another problem is the amount being paid to house children with challenging behaviors in care homes, which can easily reach 50K per child per week. People with learning disabilities get much lower funding. So I'm thinking this last paragraph of her comment is referring to something other than what we are actually talking about. And this is somebody who is not exaggerating, someone who is actually living it. But the government, unfortunately, and as best known to them, has closed and shut these doors for most of these workers. But now it's not only the workers that are concerned about these new rules. There have been a lot of back and forth with several other people. And one of them is the Kent County Council leader who wrote to the Home Secretary asking the government to reconsider its plans to end the health and social care visas for overseas workers. I don't even want to go into the details of other people that are also concerned about this ban on overseas care workers. But then on the flip side, somebody said this under this article, and I'll read it out, which for me is an eye opener as well. He said that surprisingly, there are still 39,000 displaced sponsored workers who have not found new sponsorships in the UK and are unemployed or underemployed. Many are living in poverty and are yet willing to work. I think the Home Office and the government need to look into this. relax the rules for this set, and enable their integration instead of losing them and or fresh overseas recruitment. Many of them have been trained, have some experience, paid taxes, hold driving licenses, and are ready to work, but for immigration restrictions, making them unemployable. So yes, we agree that the ban on overseas recruitment is concerning to a lot of people, but we should also not forget that there are still people that are in the UK. Hopefully, they are still in the UK. They've not been sent back home yet, that have lost their sponsorships, or maybe the Home Office has given them 60 days to leave the UK. These people are employable. And according to this person, what this I've just read out, most of them have been trained. They're already very eligible to be employed. These people can still be employed. But then we also know that the government has already stopped this. When the rules came into force, it says that the rule to recruit from this pool of people that have lost their sponsorships also was ending. So alongside ending the overseas recruitment, these people are also affected as well. Providers are no longer required to first of all recruit from this pool before considering other people that are already in the UK. So that is where I'm not really getting it, because if there's shortage in the healthcare sector and people are still calling for overseas recruitment to be open, what about the people that are already here that have lost their sponsorships? But here is what we are not talking enough about. In all of this that is going on in the internet, people still need care. Elderly patients, adults, children with disability, families that are struggling to cope, and a lot more in other categories that are still requiring care. And whether there is a political debate or there is no political debate, the work doesn't go away. It is sitting there and staring at all of us. So who is going to do it? If this report suggests that the Brits are leaving the care sector and the government has said no more overseas recruitment, and the number of student visas are also declining, of which we know that the only people that are immigrants at the moment that can really qualify for this health and care worker visa, either students or graduate visa holders. Because as a skilled worker, or if you're on certain other categories of visas, you may not be able to get a health and care worker visa because of the requirement to work 3 months before you're granted a COS. Who is going to do the job? Most care workers are really burnt out. Some are working 2 jobs just to make ends meet because the pay is not enough. So I think a lot need to be considered when it comes to the care sector. And this is not about immigration or no immigration, because the vacancies are still staring at us. And humanly speaking, we cannot allow patients to suffer because of all these things that are happening at the moment. It is not my word. The reports have said it all, and I'm just bringing it to you. But here is what I hope that this video makes clear. Number one is that migrant workers aren't the problem. In fact, they've been part of the solution. The second thing is British workers aren't lazy. They are just probably tired and underpaid. And families are just stuck in the middle and watching what is going on in the system at the moment. This isn't about politics. It's just the truth that without support, recognition, and respect, the care sector will only suffer. So, if you don't mind, share your thoughts in the comment section. Have you ever worked in care, and have you seen how much foreign staff are being relied on? Let me know in the comment section, because your thoughts may just help others feel seen or bring a little bit of light to this report. I thank you for watching up to this point. I will see you in my next video. Bye for now.